Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
We've often talked about diabetes on this Health Talk program, how to treat diabetes. But today we're going to talk about how to keep you from developing diabetes, prevention of diabetes on Health Talk, brought to you by Mon General. I'm Jim Stallings, along with co-host Kay Murray. Good morning, Kay.
Good morning, Jim. Yes, there's a new program starting, in fact.
With us in the studio is Andrea McCarty. She's no stranger to Health Talk from Mon General. She's a diabetes education coordinator. Did I get that right?
You did. You should be used to saying that by now.
I should be, because you might be in the 5-time guest club here on Health Talk. It's good to have you back.
Which is huge, by the way, Andrew.
Thanks for having me.
The National Diabetes Prevention Program is starting up next month at Mon General Hospital. So tell me why.
Well, one of the big reasons is because diabetes has become so prevalent in our country, but also in the state of West Virginia. We have one of the highest prevalence of type 2 diabetes. But there's something called prediabetes, where some people may have heard it called borderline diabetes. Maybe they've been told that before, where their blood glucose is higher than normal, but it's not quite high enough to diagnose diabetes. And this is a program that's geared for those individuals.
Who is most susceptible to developing prediabetes? Who should be really lending an ear to this program a little closer?
The older we get, the higher we are at risk. Also, if you have a sedentary lifestyle, in other words, you're inactive, or if you have a BMI that is in the overweight to obese range, that would put you at higher risk. For women, if they've had a history of gestational diabetes, that's also a risk factor. Those are just some of the bigger ones.
And when will your program get underway?
The program begins May 22nd, and we're currently recruiting individuals to start that. We're looking for at least 10 people to sign up for that program. And most importantly, thanks to grant funding, it is completely free.
And, of course, this is not a good time for Kay and Jim, because this program's going to be on about 9 to 10 o'clock in the morning.
The first group we're going to do is going to be 9 a.m. to 10 a.m. However, we will start additional groups after we get this first one started, and we look to do it at different times, possibly lunch hour or after work.
Or an evening.
Yes.
So finish this sentence. You would be perfect for joining this group if you...
Good one. If you have a BMI of 24 or higher, you have to be 18 years or older.
Where do we usually get a BMI? I don't. I guess maybe I just avoid that number.
You can do a quick search online, a BMI calculator. Basically, what the BMI is, your weight in kilograms divided by your height in meters squared. So if you don't know the conversions to do that, you can do just a quick BMI calculator. Just look for that online, and it will figure it out very quickly for you.
Okay, so if you have a high BMI, and you said that number above...
24 or higher.
24 or higher. Okay, who else?
You have to be 18 years or older. You either have to have had gestational diabetes in a previous pregnancy, or you have to have been diagnosed with prediabetes. Now, how prediabetes is diagnosed is if you had a fasting blood glucose reading of between 100 to 125, or if you had an A1C test and the result was between 5.7 and 6.4%, or a random finger stick or lab test anytime during the day that the result was between 140 and 199.
So you said they will have had gestational diabetes?
If it's a woman.
Okay, I was going to say, that would eliminate most men.
The other thing is, if you have none of those clinical indicators, none of those lab results, if you test positive on the diabetes risk assessment test, which is something you can get online, then you also would qualify for our program. Some of the questions on that risk assessment test involve how old are you, what is your height and weight, is there a family history of diabetes? If you answer yes to some of those questions, you would also qualify for this program.
Once in the group, obviously you've developed a plan to help people to keep them from developing prediabetes into diabetes. And so that always involves nutrition,
yes,
right?
Yes.
Exercise.
Yes.
and these types of things. So how did you go about building a program here?
Well, we didn't build it. This is actually the National Diabetes Prevention Program that was studied. They studied it when it was provided in individual sessions, and they found that the people that went through that program over 3 years, they were able to decrease their risk of diabetes by 58%. But that was for people under the age of 60. For those over the age of 60, they were able to decrease their risk of diabetes by 71%. More than half of them lost at least 5 to 10 pounds, and over a year or more, they were able to 87 or 88% of them maintained all of that weight loss. Plus, they lowered triglycerides, they lowered their cholesterol, they lowered their waist circumference, and obviously their weight. But the program itself, the goals of it are to adjust the eating habits. The focus is increasing fiber and decreasing fat to help promote weight loss. I mean, there's no eat this and don't eat that. That's not what the program is. Also promoting 150 minutes a week of physical activity. And then we provide the program. It's in a group setting. So you get that support from the other group members that are making these lifestyle changes with you.
It's not about going on a diet.
Exactly. Because when you think about diet, we usually think of something we would do for temporary purposes. And this is something you want it to be a permanent lifestyle change so that you're not only preventing diabetes today, you're preventing it 10 and 15 years from now.
When you talk about group exercise, are you just going to give suggestions, or will we actually be doing the exercises together?
We will just give suggestions and give connections to area places where they can go to walk. One part of the program, each participant will be provided with a pedometer and resistance bands, so there's some activities they can do on their own, and they'd have a way of tracking how much activity they do.
If we have not been to the doctor for a while and we have not had a multiphasic or a blood test, will we go through that again with this program?
Because this is a free program, we do not need physician referral for it. We do, unless we have a patient sign a consent, we will not even contact a physician's office for lab work. So that won't be necessary.
You won't be doing any type of a glucose. You'll just take our word that the doctor said we need to do this.
Right. And in all honesty, most people that are testing have those clinical indicators for prediabetes. They're also going to test positive on that risk assessment test that we could administer ourselves.
Considering the numbers in West Virginia, 10's not a lot of people. Wonder if you get 40 or 50 that sign up. How are you going to break that down?
Well, we want to start one group and get it up and running, at least because you meet once a week for 12 to 16 weeks. We want to get it rolling for a few weeks first before we add in a second group, because we want to make sure the other option or consideration we have is making sure there's conference room space available at the hospital at a time that is conducive to those that want to attend.
So it's going to be a first-come basis?
Mm-hmm. And for those that don't fit into this group, we will have them on the list to start the following group. If we have 20 or 30 right off the bat, then obviously we're going to start a second group pretty quick.
And so people won't feel intimidated. It's not going to be the fact you're going to come in and get weighed in every Wednesday. It's more or less trying to teach us or educate us how to do better with our diet, exercise, and so forth.
Correct. And we give you as many of the tools as necessary to do that, plus the support. You have a lifestyle coach, the same one most likely will teach every single group session, and you're in a group with the same people every time too. Because when you try to make a lifestyle change, if you don't have support around you and how to do that after you leave that class, it's extremely difficult to maintain that change.
So if we want the first 10 to be exclusive Morgantown AM listeners, we're going to offer it to them for free.
Good job.
And can they call somewhere right now during this next commercial break if they want to?
If they're interested, feel free to call our office. Unfortunately, I'm here and I am not there to answer the phone. But
I would expect you to have a secretary, for goodness sake. I mean, an administrative assistant.
I used to, but I currently don't have one.
Okay.
But our phone number is 304-598-0763.
What if they leave a message? Will you call them back?
Yes, leave a message and I will call you back as quickly as possible.
What is the number again?
It's 304-598-0763.
Diabetes Education Coordinator Andrea McCarty, our guest on Health Talk, brought to you by Mon General on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Andrea McCarty, Mon General's Diabetes Education Coordinator. And when fighting diabetes, I think half the battle is education.
Correct.
Knowing how to stop it or prevent it. And so really we're targeting those of you that may be pre-diabetics, because you you don't have to go into full diabetes if you're educated and do the right things, I guess, to keep yourself healthy.
Correct.
And again, why did you start this? Well, what is the purpose exactly to start something like this?
Well, the biggest driving force in getting us to start this came a couple of years ago. We have patients referred to our program all the time that don't have diabetes. They have prediabetes. And unfortunately, most insurances will not cover our program, so it becomes cost prohibitive for anyone to participate. So we were looking for an alternative and found this curriculum. We have trained to provide it, and we just hoped and prayed we could offer it at an expense or a cost that people could afford. So when we were able to get the grant funding so we could provide it for free, we jumped on that opportunity.
Again, talk about the commitment that we're making to come to this program.
The program is a 1-year-long program. The first 12 to 16 weeks are you come once a week for an hour each time. Then after the initial 12 weeks, you're coming down about once every other week for a month. And then the last several months, you're coming once a month. And there's some additional follow-up or support that is offered the final few months of the year for those that need that additional support.
How long do you see the classes going on a given night? An hour, 2 hours?
It's an hour long each time.
It's just 1 hour?
Just 1 hour each time, yes. So when you're looking for that type of time commitment each week for a period of time, certainly an hour would be, we don't want to ask for more than that.
You say we're going to leave and understanding what we need to do. What do you hope to instill in the people that come out to this, that when they leave this program, they're not going to go back to the old habits again?
Several of the topics you cover during class, we've talked about how it's going to cover meal planning and physical activity, but there are several classes that revolve around how to handle it when you fall off the wagon, because we're humans and we will do that, how to handle stress or stress eating, how to plan for holidays, how to plan for life, essentially, with the lifestyle change. So some of the topics that are covered will help people adjust to the change itself.
I'm sure you're going to follow and chart out to the progress of each and every person. What happens to that after you finish?
That's data that we have to track, and no names would be associated with it, but we want to track how effective it has been in the people that have come through the program. And because this is a grant-funded program, we have to submit certain data. We have applied through the Centers for Disease Control, CDC. They have a recognition program for programs like the diabetes prevention program that use this curriculum. They track that data because they are trying to work with different insurance companies and payers to see if they will start paying for a program like that. So that the data we get from the weight change, how much physical activity people are doing, so on and so forth, we will submit that for our recognition piece.
And I just wanted to follow up, and I'm sure from all this, you will educate us, but in terms of what we do with the program, we'll probably educate you as well with how we're coming out of the program.
Yeah, and that's exactly what I've learned over the years of doing even just diabetes education in a group session. Often the educators will learn as much as the people in the group will learn.
I'm not a diabetes educator, but I like to think that those that have spare tires around their bellies, those that even have love handles, those are the nice words for those things. And I'm not sure if that definitely equates to a BMI above 25, but I think that those people that have the love handles or the spare tire should probably go ahead and check their blood glucose level if they can pick up a meter somewhere at a drugstore and check it out that way.
Right.
And that's a good idea, I think. And are there any other symptoms that if you're pre-diabetic, I mean, because people come up to me and say, man, I think I'm diabetic. I was going to the bathroom all night last night, and, and they give me these symptoms. But for a pre-diabetic, are there certain changes?
That's the sad part with prediabetes, as well as for many people with newly diagnosed type 2, you don't always have symptoms. The symptoms of a high glucose often don't come until your glucose has been high for some period of time. For prediabetes, if you don't have the opportunity to test your glucose, you can go online or call our office and we can talk you through that risk assessment test. On the American Diabetes Association website, they even have the risk assessment test there. You can go directly there. Again, you can call our office and we can take you through the questions. The questions are going to be related to family history, weight versus height, your age, and if you had a baby that weighed over 9 pounds at birth.
And I'm sure in our minds we're thinking, well, okay, we're not a diabetic. We know that. But pre-diabetic, are we still damaging our body in certain ways? Are we still have to have a heart attack or a stroke or do kidney damage?
You can do damage, but the challenge is pre-diabetes, if left untreated, almost always turns into diabetes, and there definitely is research supporting the fact that their damage can be done when your glucose is elevated. So the goal of treating prediabetes, to treat it, we use meal planning, physical activity, the lifestyle change, what you need education for the most, and that can potentially prevent diabetes, which could equal the stroke, the heart attack, other issues.
304-296-0041. Any last-minute questions you want to ask Andrea, pick up the phone and give us a call during this break. You're listening to Health Talk, brought to you by Mon General on WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Mon General's diabetes educator, Andrea McCarty, Mon General's Diabetes Learning Center and new National Diabetes Prevention Program is going to be starting in May, and that's what we've been talking about this morning. Hopefully you've learned something about yourself. If you think you may be pre-diabetic or type 2 diabetic, then you would want to call Andrea. Once again, she'll be able to return your call once she gets back to the office. And right now you're looking for 10, but that doesn't mean that you should discourage people from signing up if you already get your 10, because this is just the first program starting in May, and there will be others to follow.
Yes, and how soon we will have another group to follow depends on how many people we have waiting to start it. We want to get a few weeks in at least to the first round, first group that we start. Future groups we will start at different times of the day, because I'm sure for a lot of people 9 a.m. on a Wednesday morning may not work for them. We hope to do lunch hour and evening groups in the future. This is when we needed to start the first group. So, and the first group starting through the summer months, morning time might be a little better at that time, but we will have additional groups starting.
We can certainly see whenever we go out into public to go shopping at a big box store that a lot of West Virginians are overweight. There's no question about that. I think of Asians, and I don't really think or can't think of any overweight Asians. I don't imagine their diabetic rate is probably much lower than ours is.
Well, in the Asian population, it does not include just the countries that many identify as Asian. It also includes other countries where there is a very high risk of diabetes, possibly as high, if not higher, than we see in the United States. When mentioning that risk or what makes you qualify for this program, a BMI of 24 or higher in the Asian population, and a BMI of 22 or higher would actually make you qualify for this program. So they do make the BMI a little lower.
I know what you're saying, because Asia is the largest continent. There's more than just Japan and China involved here. So I understand what you're saying.
For people out there that cannot make this program, but they want to get started on something, just in about a minute or so, can you just give us a way to get started?
The first thing to start is the physical activity piece. 150 minutes a week can break down to 30 minutes a day, 5 days a week. Simple walking in comfortable shoes is effective. That will work. Other things to do is work on increasing the fiber in the diet with the ultimate goal of 25 to 30 grams a day of fiber, and decreasing the fat in the diet. And the amount of fat depends on how many calories you're consuming, so that I can't give a set number for, but decreasing the amount of fat in your diet, either by doing smaller portions of high-fat foods or replacing high-fat options with lower-fat choices.
And that telephone number again, if what people have heard this morning is interesting them?
It's 304-598-0763.
Yep, and if you want to be educated about diabetes, Andrea is the perfect person for it. That's why we keep bringing her back time after time here on Health Talk.
Thank you.
I hope the phone rings off the hook, or you have hundreds of messages.
Then she's in trouble.
So too. Then we'll cross that bridge when we get to it.
That's right.
Yep, that's right.
Be a good problem.